Which of the following is the most common etiology of intracerebral hemorrhagic stroke? A. Medications. B. Arteriovenous malformation, AVM. C. Trauma. D. Hypertension. The answer is D. Hypertension. Hypertension is a leading etiology in intracerebral hemorrhagic stroke. Chronic hypertension can cause damage and stress to the blood vessel wall, leading to aneurysm or increased risk of spontaneous rupture. AVM, trauma, and medications such as blood thinners are all also responsible for a significant, though lesser, number of hemorrhagic strokes, or may be comorbidities that increase the risk of a rupture in the presence of prolonged hypertension. What is the most common cause of meningitis? A. Viral infection. B. Aseptic inflammation. C. Bacterial infection. D. Fungal infection. The answer is A. Viral infection. All of the answers given are possible causes of meningitis, but the most common, and least severe, etiology is viral. There is no vaccine for viral meningitis, but there are vaccines for 3 different organisms that cause bacterial meningitis. Neisseria meningitidis, meningococcus. Streptococcus pneumoniae, pneumococcus. Haemophilus influenzae type B, Hib. A client has a history of spinal injury and the nurse is evaluating the client with the onset of new symptoms. The symptoms include hypertension, a throbbing headache, a slow heart rate of 40 beats per minute, and piloerection. The nurse recognizes these symptoms are consistent with what disorder? A. Brown-Séquard syndrome. B. Spinal shock. C. Neurogenic shock. D. Malignant hypertension. E. Autonomic dysreflexia. The answer is E. Autonomic dysreflexia. These symptoms are evidence of autonomic dysreflexia, which is a sequela of spinal shock. It is a medical emergency and requires immediate intervention as it may lead to stroke, cardiac arrest, coma or death if untreated. A 23-year-old male college student presents to the emergency room after experiencing a high fever, nausea, vomiting, and knuckle rigidity. The nurse recognizes that this combination of symptoms are indicative of bacterial meningitis. The nurse is aware cranial nerve dysfunction is related to the condition. Which of the following cranial nerves, CN, is correctly matched to its dysfunction? A. Irritation of CN6 may cause hearing disturbances such as tinnitus. B. Irritation of CN5 may lead to loss of the corneal reflex. C. Irritation of CN3 may cause pupil edema as seen with increased intracranial pressure. D. Irritation of CN2 may cause ptosis, a drooping of the ipsilateral eyelid. E. Irritation of CN8 may cause deficits in facial movements. The answer is B. Irritation of CN5 may lead to loss of the corneal reflex. The trigeminal nerve, CN5, is responsible for both sensory and motor functions of the face, including the corneal reflex which is also mediated by the facial nerve, CN7. CN2, optic nerve affects vision, including causing pupil edema, swelling of the optic disc. CN3, oculomotor dysfunction may cause ptosis. Cranial nerve 8, vestibulocochlear is responsible for hearing and cranial nerve 6, abducens is responsible for horizontal eye movements. A 27-year-old female presents complaining of an inability to smile normally or close her left eye. She states that she woke up and noticed that the left side of her face was not responding when she tried to blink, smile, or speak. She also feels a pain in her left ear. She has never experienced this before. The nurse does a physical exam, which is notable for left-sided upper eyelid retraction, general left-sided facial muscle weakness, and left-sided brow droop. There are no cognitive or sensory defects noted. What is the most likely cause? A. Otitis interna. B. Myasthenia gravis. C. Bell's palsy. D. Transient ischemic attack. The answer is C. Bell's palsy. The symptoms and physical exam of this patient are consistent with the diagnosis of Bell's palsy, a rapid onset cranial nerve disorder that results in unilateral facial paralysis or weakness. Symptoms usually come on within 24-72 hours and may include facial tingling, ear pain, taste disturbance, headache, issues with balance, cognitive changes, and clumsiness.